Dr. Jodi Radosh, a professor of communications and associate director of the Holleran Center for Community and Global Engagement at Alvernia University in Reading, Pennsylvania. I'm a former television reporter, and I unfortunately have had several bad concussions, most recently one last summer. My concussions were very disabling. I went through lots of treatment and a lot of pain, so I'm very passionate about helping others who recognize as well as understand the impact of concussions. And that's why I'm very thrilled to be hosting this webinar called Concussion Discussion, where I get to interview concussion experts and survivors. And you can also jump in as well and ask questions by typing them in the chat box. So I want to welcome everybody to our first show. I am so delighted to have such a big name in concussion research, Dr. Anthony Kontos, who is the co-author of the new book, Concussion, A Clinical Profile Approach to Assessment and Treatment. Dr. Kontos is also Director for Research for the University of Pittsburgh Medical Center Sports Medicine Concussion Program and Associate Professor in the Departments of Orthopedic Surgery and Sports Medicine at Pitt. He also specialized in concussion research for the past 12 years and has had more than 175 professional publications. Dr. Kontos, it is such a pleasure to have you on Concussion Discussion. Congratulations on your book. It's a wonderful and a valuable resource for those of us who have experienced concussions, and we're so grateful for your research on this topic.
Thanks, Jodi. I appreciate the opportunity to be here today.
Thank you. I'd like to start off by just having you explain what a concussion is, because I think sometimes there's some misconceptions that often you have to be unconscious to have concussion, and you know that's not so.
Yeah, that's a really good point to start out with, and frankly, only about 1 in 10 concussions will involve what we call a brief loss of consciousness or being knocked out. So that means 90% don't. So with that in mind, there's a lot of other things to look for with a concussion, and certainly what does it take to cause a concussion is important. You don't have to be hit in the head directly. You can have a whiplash, a movement of the head where you're contacted below and your head snaps, and that can still cause a concussion even though your head wasn't directly hit. When you do have that kind of force acting on the brain, then you have a variety of symptoms, everything from memory problems to balance, coordination issues. Sometimes your eyes and your balance system don't work well together, and you might have memory problems as well. So a lot going on with the concussion beyond loss of consciousness.
But can you explain what the difference is between a concussion and a traumatic brain injury? Are these terms interchangeable?
Think of concussion as one sort of on a spectrum of injury to the brain. So on the extreme side, you have a severe traumatic brain injury where a patient may not recover normal functioning. And down on the other end, in a more mild sense, you have concussions and other mild traumatic brain injuries where there's still an injury to the brain, but it's perceived as more transient. And frankly, it's something that can be treated and regain most functioning, if not all, back to a normal level. And certainly it's something not to be feared, but it is an injury just like any other injury, and one that we need to take seriously and make sure that individuals get appropriate assessment and treatment.
So, I sustained 3 concussions, but my one 4 years ago, I sustained when I was cleaning my refrigerator. It took me 2 years to fully recover. I was out of work for a year and basically homebound. It was devastating. And I was so surprised that something so basic as cleaning could cause a traumatic brain injury. Often we think of a more serious accident causing this type of damage. Can you shed some light on this?
Yeah, I mean, the reality is, everybody sort of takes a different force to cause a concussion. And I say that because we all have different risk factors that we might bring to the table that would make us more or less likely to have certain outcomes following a concussion. For example, someone with motion sickness or migraine history may experience, an exacerbation of those symptoms when they do have a concussion.
I know when I had my first bad concussion, I didn't really understand what was happening to me. It was very frustrating because on the outside, I had no physical bruises or scars. Even my CAT scans were normal. And, I think that's very confusing. Can you maybe explain to me what was happening on the inside? Because that's where all the damage was. What was really going on in my brain during that concussion?
Yeah, you basically focus on the part that we all know, which is this is an invisible injury. Unlike an ankle sprain, there's no swelling or visible signs or anything like that. So we have to rely on what your symptoms and signs might be from an observable and reportable perspective. And what's going on inside the brain is really an energy crisis. And by that, I mean there's a demand for energy because of the injury to the brain. And at the same time, there's not a sufficient supply of that energy. And that results in a lot of the symptoms we see following this injury.
How does one then diagnose a concussion? I think that's what can be confusing for many.
Yeah, diagnosis is somewhat complex because it involves a lot of different symptoms and signs. And so, again, it could be something cognitive in nature. It could involve vision or the eyes, disruptions to that part of the brain, or it could involve vestibular or balance-related problems and how we navigate the environment. And in addition, you may have migraine and all kinds of things. So a clinician has to be really, well-versed in the injury and all the different domains that might be injured.
It seems the common tests that most hospitals have, like CAT scans or MRIs, you really can't ever see a concussion on there because it's at the microscopic level, but they're really looking for other things like a brain bleed. Are there any new tests that are being done or developed to better diagnose concussions?
You highlighted an important point, and that's CT and MRI does not see concussion. 95% of the time, a concussive injury shows not any kind of findings on those tests. And so that makes the test for concussion really a clinical diagnosis involving, again, multiple domains and assessments. Recently, there have been some media reports about a single test for concussion, and I'd be cautious about that because it's a very complicated organ in the brain, and one test is probably not going to accurately identify all concussions.
Okay. I think what is very surprising that in your book, you really talked about how concussions go way back, that they were documented by ancient Greeks and Egyptians that obtained these injuries during battle. But why are we now just learning how to treat concussions?
Yeah, we've known about concussion for a long time. In fact, it comes from the Latin to shake violently, and the reality is up until the last really 5 to 10 years, treatment for this injury has largely been, if anything, just rest, or as you mentioned earlier, sort of restriction from activities, what we might call homebound. And we know that that's actually counterproductive in most cases. And in fact, there are active treatments that can target specific systems affected. And that's really the best way to get back from this injury and to recover quicker.
Another thing that was interesting, the main message of your book and research is that no two concussions are alike and they shouldn't be treated the same, that there should be more a heterogeneous approach to treatment. In fact, in the book, you make a very interesting analogy that concussions are actually like breaking waves.
Yeah, and then that's a little bit of the surfer in me, and the idea is that what's under the surface affects what that wave is going to look like, and that's true of concussions. So, what the injured individual brings to the table will affect how that injury manifests itself, and it'll sort of what we say play dirty. Concussion targets systems that are vulnerable and kind of exacerbates those symptoms, and for that reason and others, this is a highly individualized and heterogeneous injury.
But I think another point that you really make is that, for me, when I had my concussion, I had so many different symptoms. I was dizzy, I had nausea, extreme light and noise sensitivity, fatigue, migraines, headaches. I couldn't read, couldn't watch TV, couldn't look at the computer. And, I'm not alone. So can you kind of shed some light on what you see are some of the most common symptoms of concussions?
Well, one of the most common ones is, as you might expect, is headache. And we see that in about 60 to 80% of all concussions. But there are many other signs, and dizziness is very common. We also see some balance issues, but
Are any of them, are there any potential long-term implications from some of these things?
that's a good question. There aren't really good research studies on the long-term effects of concussion. We certainly know that most concussions, individuals, athletes, civilians, doesn't matter, military, they recover fully if treated and managed properly. However, certain individuals with certain risk factors may be at risk for some effects. But again, we don't know a lot about this from an empirical perspective. Hopefully we will soon in the near future.
I hope so too. I really do. And when we think about this, are there any certain risk factors that make certain people more susceptible to concussions or the effects of concussions? I know often you see some of the research that women, because of their thin necks and hormones, that they can take a longer time to get better from concussions. Can you talk about that?
Yeah, we talk about these as sort of risk factors, and certainly females have been supposed to have some risk associated with this injury. although the evidence is strong, it's not really strong. In fact, it's a little stronger for things like age, concussion history, migraine history, and even motion sickness history or car sickness as driving you down specific pathways following the injury. So if I'm motion sick, I'm more likely to have a vestibular type concussion. And if I have migraine history, I'm more likely to have a migraine type concussion. And we know more about that. But also middle adolescence is a good risk period too. So those, like my son, 16 years old, that's a good risk period for concussion as well and its effects.
In addition, you're talking about your son, a lot of times too with, children and concussions where parents are very worried about their kids. I think a question a lot of parents have is when should they allow their kids to play sports? Are there, and, that their brains are still developing. So, what are your thoughts on that?
Well, first of all, I encourage my child and my son and daughter, 17 and 12 respectively, to be active and to play sports. We all know the risks associated. They play soccer and basketball and some other sports. And the reality is there's a risk to almost everything we do. We can't completely insulate or sort of bubble wrap our kids, but I think any parent has to weigh those risks for potential injury. There are all kinds of different injuries with the benefits of being physically active and being healthy and all of the mental and positive physical effects as well.
The NFL lawsuit has really shed a lot of light on concussions with the recent motion picture as well. But we know that's not also just on concussions. That's on something called CTE. What is that and how does it relate to concussions?
Yeah, it's interesting you bring that up because the movie's called Concussion and it's really not about concussion. It's about what you called CTE or chronic traumatic encephalopathy. And again, this is something that's been referred to as punch-drunk pugilistic dementia, something that's been written about since, the early part of the 1900s. And so, again, not something new, but something we're learning about. And we really don't know exactly what causes it or what the risk factors are. We know that most people that have been reported to have CTE actually tend to have a lot of other things going on as well, psychological disorders like depression, mood issues, anxiety, but also potentially substance abuse and other things. So we're not sure what the role of concussions or exposure to certain sports is. I think the jury's still out, and we need to do better research to really understand those long-term effects, if any, that might lead to something like CTE or something else.
What about, when we talk about this, just the idea of having multiple concussions? I had 3 concussions. My first concussion I had when I was much younger. I was a teenager and I was hit on the head with a metal baseball bat. I was knocked unconscious. What was ironic though, I didn't have post-concussion syndrome. Then recently, 4 years ago, I hit my head cleaning a refrigerator, kept me out of work for 2 years, had a horrible concussion, and then unfortunately this past summer hit my head doing the backstroke into the wall and didn't seem to take much, and it kept me out of work again for another semester and had the same vestibular and ocular damage and symptoms that I had. So, this idea of multiple concussions and the damage as you get older seems to me like it's so devastating. And I've been told that I have to be very careful that I'm something like more than 8 or 10 times more likely that if I hit my head, I can get a concussion. Is that true? That your risk factors go up the more that you have concussions?
It really is a bit of a misconception that with each concussion you have greater risk. There are some people that do, and you always want to be aware of if lesser force causes an injury or if your symptoms become worse and worse with progressive injuries. But that's not true of all people. We've seen, patients that have had 4 or 5 concussions and they recover fully from each one, and then later on they're quite fine. And we've seen other patients with maybe 1 or 2, and they don't do as well following that initial injury. And so it's very variable. It's not consistent, and a lot of risk factors and things go into whether or not you recover quickly or slowly. And one of the main ones is that you get assessed and treated properly in a targeted, active way early, so that we can get you back, to whatever it is you want to be doing as quick and as safe as possible.
So let's talk a little bit about the therapies then. As I just mentioned, I went through a lot of occupational and physical therapy for my vestibular and ocular issues. What do you think is the best way then to treat a concussion?
Well, I think one thing is what's the worst way, and that's the cocoon therapy and the shut the door and turn off all your technology. You know, that would drive any 16-year-old or 17-year-old nuts these days. But even adults, we rely on this technology and things. So that whole idea of withdrawing and complete rest is really starting to be debunked in the research. In fact, we know that may have adverse effects by causing people to focus too much on their injuries. So an active approach is very important. And one that's driven by symptoms and impairment, and not just by the fact that you have a concussion, but rather the type of concussion that you have.
Is there a certain science behind these therapies? Is there a lot of data and evidence? You know, are there certain therapies that you know are more beneficial than others?
Well, you bring up another really important point, and that's we need more research to develop better evidence for these therapies. We know anecdotally and from a case-by-case perspective, and in the book, we talk a lot about cases with specific targeted therapies. So we're building that evidence. Right now, we're engaged in a couple of randomized controlled trials to look at the vestibular therapies that you mentioned. And we think those and the vision ones are really good candidates to look at because they really target those systems that are involved in the brain, and they're very active. And from a physical therapy perspective, they give something for the patient to do to help manage their course of recovery. And we think that that's a very effective approach.
Okay. You know, we hear the term brain rest a lot when you're in the treatment of concussions. Is there evidence that people with concussions should stay completely out of activity? I thought the hardest thing for me was resuming that level, when to know to go back in, because often when I did, I felt like it was too much and it set me back.
Yeah, and again, that depends on the type of concussion you have, but certainly I think it's important that you balance symptom provocation. So if you do something active and it involves maybe moving your head and you have a vestibular concussion and that brings on symptoms, that's certainly something you should then look at maybe dropping down a little bit. But if it doesn't provoke symptoms or it only provokes them a little bit, that's really similar to what we do with exercise, where it kind of makes us a little uncomfortable, but we progress through it and then develop better muscle or fitness from that. And that's very similar to the exposed recover model we use to treat concussion. But again, you have to be mindful. The clinician has to know how to balance that with the amount of symptoms being provoked. And that's the part we need to do good research on and really have these randomized trials come to fruition so we can inform that a little bit better.
You know, one thing we haven't talked about are medications. Are there certain medicines that you think are effective in helping concussions?
There's no one medication to use with concussion. In fact, we try to be more conservative with treating this injury through therapies and active approaches and behavioral management, dealing with stress, better nutrition, sleep, etc. Certainly those things are important. Some patients don't respond well to some of these therapies, and that's when we might look at medications that are very targeted. So if you have a cognitive issue or attentional issue, we're going to look at maybe something that would address that component, like stimulate the ability to attend better or to remember things better. It's just like there's one pill to take following a concussion. There certainly isn't. And most medications are mostly masking symptoms as opposed to actually treating the underlying concussion.
You know, I was very, you're kind of desperate when you're going through the concussion to get better. And I was looking for anything that would make me better. And there's some literature there on nutritional supplements. And I know there's not a whole lot, but I wonder if you can talk about that, because I, at times, were taking fish oil pills and so forth. And I'm not sure if they helped or not, but I'm hoping that maybe that's an area that will, I guess, expand in research.
Yeah, I would agree. We if it works, we want to know that it works and see the evidence behind it. And a lot of these nutritional supplements, lack that evidence. That said, there are some that have more evidence in areas than others. A good example is magnesium with headaches. There's a little bit more evidence there than on some of the other nutritional supplements. But again, the jury's still out on many of these, and there's the huge placebo effect, just thinking that it's going to do something that certainly has some positive effect as well, potentially.
When we talk about the research, there seems to be a gap in what many doctors are practicing versus what the research is showing. And I guess because the research is so new, how do we get the word out there to the front lines? And I'll give you an example. In my concussion support group, many people have shared stories that they were in emergency rooms and then released and told back to get into their lives, but never given any information what a concussion is or what could be a possible symptom.
Yeah, and this is a very important thing to consider. Anyone who has a concussion needs to then get follow-up specialty care, and I think that's where we fall a little bit short. Somebody goes to the emergency department, they are told they have a concussion, kind of sent on their way with maybe a week of rest or something arbitrary. And if they have problems to follow up, and we found in research that 60 to 65% of people do not do anything after that initial evaluation, or they don't know what to do. And that's a big problem because we know that we can really affect some positive change through these active therapies. But if people aren't coming in for follow-up care, then it's unlikely that they're going to have those benefits.
I want to talk about your book a little bit now. In there, you use a term, concussions play dirty. And I thought that was interesting. You say that because they magnify pre-existing conditions or risk factors. And what does this mean?
Well, I'm going to give you an example of what it means. My wife had a concussion a couple years ago. We talk about this in the book. And her concussion, it was from a soccer ball hitting her head. And it involved a rotational force that resulted in vestibular migraine-like symptoms. And those are the two risk factors she kind of brought to the table that caused her to play dirty, which is the reality is she has car sickness, motion sickness, and she's a migraineur. And those were the two things that the concussion kind of affected the most following her injury, kind of playing dirty and magnifying those conditions. But with proper therapies and active approaches, within a month, she was actually back to her same old self, thankfully, and everything went really well.
That's amazing. That's great that she was able also to heal so quickly. I'm just looking, we do have some questions here from some people that are in the panel. And one of the questions here says, is there any talk of schools or little leagues eliminating football? That gets back to our earlier concussion, that discussion that we were talking about, there with the recent NFL and the light that they're shedding on sports.
Yeah, we've done some research actually that was funded by the NFL about 3 or 4 years ago that we published on Pop Warner style Little League football, whatever you want to call it. And we found that, first of all, there were very few concussions at the younger ages. These are 12 and under. And the forces generated are pretty low. That said, there's certainly, are some risks at those younger ages. And there's certainly talk of arbitrary age groups at which only flags should be played and non-contact football or non-contact other sports. But again, there's no evidence really behind that. It's somewhat arbitrary at this point, and we need to figure out really if there is any evidence or reason for doing that.
I'm looking to here when you talk about that, obviously concussions have touched home with you. You have had concussions. You mentioned your wife's concussion, so it's something that I'm sure makes you very passionate about studying this. And I know it makes me very passionate since I've had them of wanting the answers. What do you think are some of the next steps right now that we really need to look at in terms of concussion treatment and research?
Well, we need to do just that, and that's look at treatment and which treatments are effective for which patients, how much of the treatment, and when should we start the treatment. This is like the dose response. It's like how much of a drug do you need at what time, and this is true of these active approaches too. We need to learn when should we start the treatment, how intense should it be, how frequent should it be, and with which patients should we use that treatment. And when we start to learn those questions, imagine the day you can come to a concussion clinician and be told, you have this type of concussion, we're going to do these things starting on this date, and you're going to be expected to be recovered based on these things at around this time.
How far out do you think we are in getting those kind of answers? Because I know this is happening at the microscopic level, so it is so difficult, I'm sure, to do the research on it because you can't see it and it's invisible to so many.
Yeah, I think it's starting now. I think we've already seen the seeds planted for this and the new randomized trials that we're conducting, and others are as well. However, I think we probably are at least 5 years away from when that's going to be the norm, maybe 10 years when it's across the country and the world. We found a lot of variability in the treatment of this injury as we've traveled throughout the world and started training folks elsewhere. And there's a real disparity in knowledge from where I'm at right now today in Pittsburgh to somebody living only maybe 50, 60 miles away in a more rural location. So again, we want to get the message out there, and we need to do a better job, and we need to have better evidence to do that.
You're doing research, obviously some great cutting edge research at University of Pittsburgh, but who else is doing research on this area?
Well, there's a lot of great groups doing work on this down at Carolina, We have people out in Boston at Harvard. We have folks that are at the University of Arkansas, out in California, Michigan, you name it. It's starting to spread, which is good. Florida as well. And we have a lot of colleagues, a lot of people that believe in the approach that needs to be more active and targeted. In fact, we had a meeting just 2 years ago where 43 or 42 experts from around the country came together and agreed to a bunch of bullet points, so to speak, about where we need to go with this injury. And we're getting more and more sort of momentum behind this approach, and hopefully it'll continue to spread and help to benefit the patients that are affected by it.
That would be so wonderful to get these answers. In the meantime, how can people help not get concussions? What are the things we can do? Are there certain helmets that will help reduce sports-related concussions? As I mentioned before, my last concussion, I got swimming in the backstroke, unfortunately, into the wall, and someone just sent me a link to a swim cap that they thought would help me prevent concussions. Are there things out there that can help? I know many of us are desperate for them.
Yeah, I'm unfortunately the answer is not really. The cap you just mentioned would probably help you not cut your head, but it certainly would not prevent a concussion. Helmets are designed to prevent skull fractures first, which is a more severe injury. They help a little bit with concussion, but again, you don't have to be struck in the head. So bear that in mind with any preventative device, whether it's a mouth guard or a helmet. It's only going to have a minimal effect because, again, you don't have to be struck in the head. And even when you are, those are designed to mitigate other forces, not necessarily concussion.
Which can be really scary. We have some other questions here that are coming up on the side. And one of them is, how does one determine if a concussion is fully healed? And I think that's a great question because people here are always asking me, are you better? Are you back 100%? And somewhat I can tell by how I'm feeling, but I'm always curious myself, am I healed? I still have some, light and noise sensitivity at times.
Yeah, well, we look at symptoms, first, and then impairment, cognitive, vestibular, ocular, balance, gait, walking, etc. And importantly, how do they tolerate exertion and not just running on a treadmill, but also moving laterally, side to side, head and eyes, integrating a lot of stuff what we see in sports. And so you have to look at the exertional piece as well. And the reality is that what you do is make an individual decision based on all of those factors. Hopefully you have some baseline measures and baseline functioning so you know what they look like normally, but even in the absence of that, you're looking for are they back to what we would expect for someone healthy, their age, their gender, etc.
Excellent. We've been spending so much time talking about athletes a little bit and how they're a very big at-risk population, but in your book you also mentioned the military, and I started a concussion support group here at the university at Alvernia, and I had some students who have fought and battle for our country, and they still have those lingering concussion symptoms. And I know there's not a lot in battle that often can be done maybe to prevent concussions, but is there things that we can do to help this group?
One of the most important things is creating an environment for them to get assessed and treated. In the past, that had been a challenge in the military because everyone wanted to sort of tough it out and keep going, get back to their unit. We do a lot of work with special operations forces, and that's certainly how they are. They're like NFL athletes, and they're doing a much better job in the military. They've been very progressive with this injury, especially since Iraq and Afghanistan, and I think they're doing a much better job now of assessing and really identifying people that need to get better care and whether or not they're developing other issues following their injuries as well.
That would be good. I mean, that is such an important target audience and group that is at risk population, as you said. And let's talk about the book too, because you use a lot of fascinating different terms to talk about concussions. And another thing that I really struck out is that you talked about concussions being a bit of a boogeyman, something very feared and not very well known. And why do you think that is?
Well, I think some of the things we've discussed already, like CTE and then the fears associated with the injury, being told to go into a dark room and that your symptoms are so bad you can't do anything, all you can do is rest. All of these things lead to fear, and when we don't have good education awareness that there are things we can do that are positive to affect change, to make people better, to get them on a path towards recovery in a safe and hopefully more quick manner. that kind of results in this fear. And I think we need to do a better job balancing that and getting that message out there that there's something you can do about this injury to get back to normal and to go back to your lives, whether it's in sport, military, or civilian life.
Let's talk about the book. Where can people get the book, and how long were you working on this research?
Well, as my wife would say, too long. It's been a while. Obviously, book takes a while, and it's a culmination of my 12, 13 years of research, Dr. Collins' 18 years of clinical experience. And the book is available at APA Books and I think Amazon.com and the usual book outlets. And it's released tomorrow, the 27th of March, and we're excited about it. We think it's going to cover a broad audience and hopefully get the right message about this injury.
Dr. Kontos, I want to thank you so much for joining us. I'm so excited for your book, Concussion, a Clinical Profile Approach to Assessment and Treatment. It's wonderful. It's such a valuable resource, and I really commend you on what you're doing. And I look forward to the day when there is a cure for concussions, and hopefully this won't be an issue. And I look like you're headed in that direction. So thank you so much for joining.
Thank you, Jodi. I appreciate it.
Thank you. And we look forward to hearing more about your excellent research. I also want to make sure that I thank the Friends Health Connection for putting on this program. They are devoted to making a difference in the lives of others. This show will be available on the Friends Health Connection website. I hope that you'll join us for future ones. And again, thank you so much, Dr. Kontos. It's a wonderful
Thank you.
discussion.
My pleasure.
Thank you.